Sorry to interrupt. Please go to the presentation mode, the fourth button. Sorry, that near the zoom, zoom.
Yeah, just a second, sir. Just a second. Yeah. I'm not able to see the button here.
There's some pop-up there actually. Okay, in the PPT only, PowerPoint only, ma'am.
Okay, just a
Okay.
yes.
Just before the zoom, madam.
Yes.
Thank you, ma'am.
Yeah. So as we all know, the fungi occupy a very special position somewhere between all these 5 kingdom classification as proposed by Whitaker, and it interestingly is more beneficial to all of these and only very rarely cause diseases. But this rarity is now becoming commoner because of various reasons, which we will be discussing in the coming slides. The fungi, they can be classified into under the 5 phyla system, fungal phyla. Of course, it is undergoing very much of change in nomenclature these days, but this still holds valid. The chytrids are the oldest of the fungal lineages, and they are characterized by unicellular flagellated ancestors. And with the loss of the flagella, now we are left with 4 different phyla. These are the zygomycetes, the glomeromycetes, ascomycetes, and the basidiomycetes, which have non-flagellated spores. So you may ask, the audience may ask, why is there so much of a hype about fungi these days? Why are the fungi so very special? Yes, it is an appropriate question to raise because they are special in many ways, and they have been special to us over the eras, over billions of years rather, because they are more beneficial to us being a part of the ecosystem. Rather, you can see here all the green arrows, they indicate the beneficial effects of fungi, and what we see as the harmful effects are actually helpful in recycling the nutrients to the soil and the nature, and hence maintaining the ecosystem balance. The first ever antibiotic, if we all remember, penicillin was accidentally discovered by Alexander Fleming while he was dealing with the staphylococcal aureus cultures, wherein penicillium accidentally grew and it inhibited the growth. Thereby, he discovered that some secondary metabolites secreted by it is causing the inhibition of the bacteria, and this was rightly named as penicillin later on. This was far back in 1928 to somewhere 1940. And later on, there was discovery of griseofulvin, and now you have echinocandins, the statins. So basically, fungi are helpful to us in many ways because of production of their secondary metabolites that also provide health benefits. They are anti-cancer, they are edibles and nutrients. They also give microbial enzymes, which are of high industrial importance. I think there is a talk on this later on. So without going into much detail of this, what I want to say is, in general, fungi are our friends. But because of unmindful anthropogenic activities of man, like change in the land use and urbanization, the temperature increase because of increasing global warming due to urbanization and the industrialization, the extreme weather conditions caused by travel and trade, the soil degradation, extensive monoculture agricultures, and these have all led to a disturbance in the ecosystem, and hence the microbial community has changed, and the fungi, which was once our friend, is now turning to be a foe. So we need to take the onus on ourselves that it is we who have created the disturbance that has made the fungi homeless, or rather their homes have been destroyed, that they are coming out from the soil into the air and into hitherto unknown geographical areas, thereby causing unknown diseases, emergent diseases, and with the flailing human immunity, it is causing more disease in the human host. As we all know, for disease causation, there is always an interaction of all these 3 components. There should be a conducive environment, which is actually increasing these days because of the increasing climate change and its attributes like global warming and rapid geographic spread of the spores of these fungi is making emergent pathogens and newer pathogens coming up outside of their known endemic areas, and with the decreasing immunity of the human beings, which is a very, if we talk about on this subject, we can talk the whole day about it, why the susceptible host is becoming more susceptible. The immunity is going more down. That is leading to various diseases, and fungal diseases are no exception. So what I want to highlight here is the fungal diseases are all created by our own self. It is because of the disturbance in the nature, as we call it in Ayurveda. I always like to speak on this every time I take a session. Ayurveda mein kehta hai, you have to work on achar, vichar, ahar, vihar. I think since most of you are Hindi speaking, you understand that. So if we are unmindful of these activities, we are actually disturbing and de-syncing ourselves from the nature. And this is leading to increased susceptibility of the host and lowered immunity, and hence the hitherto unknown diseases are coming up. So the fungal infections, so you know why they are special now. There is an increasing threat and importance of fungal infections, although we all know that they form a most diverse group of organisms on the planet with an essential role in the ecosystem processes and functioning. Approximately 150,000 innocuous, beneficial, and harmful fungal species have been described to date, and they involve the plantae and the animalia kingdom, causing them benefits as well as harm. And they are now a major problem, affecting over 1 billion people annually. 1 billion, almost a seventh of the global population, is now being affected by the fungi. So we can no longer allay, and we can no longer dispose it off as a trivial one. We need to understand why this is happening. What are the fungi? What are the emerging pathogens? Why there is increasing resistant rates in these fungi? And of course, to complicate the solution, there is also new therapeutic options remain slow to materialize. That is, no new antifungal drugs are being discovered these days because we have almost reached a saturation. So in this condition, there is a looming threat always of very highly dangerous, very highly pathogenic fungal infections. Emerging outbreaks of the chytrid fungi are again devastating the amphibian populations worldwide. This has been in the news hit of late, that the amphibian populations are disappearing like anything. And it is because of the fungi like Magnoporta oryzae and Botrytis cinerea. They also hinder the crop production. So it is not just that the human fungal infections are increasing. The fungi are coming out of their natural niches because of the soil degradation and construction activities, unmindful activities, and they are coming into the plants and the animals and now the human beings, which were actually not their natural hosts. In the humans, Cryptococcus getae has proven to be very, very dangerous pathogen because it can also infect the immunocompetent individuals. Aspergillus fumigatus remains an ever-present danger to the immunocompromised population. I hope we all know what is an immunocompromised population. I'll come to this again in the following slides. Candida auris is the hero of today. The hero in the sense, rather an enemy of today. Candida auris is threatening patients in hospitals with exceedingly high rates of antifungal resistance, and it is spreading like a forest fire. I'll again come to this in the following slides. Invasive fungal infections caused by the genera of Aspergillus, Candida, Pneumocystis, and Cryptococcus are estimated to kill approximately 1.5 million people per year, with a mortality rate ranging from more than 60 to 70%. So just to understand, like the increasing importance of the fungal infection, these are the common fungal pathogens encountered in man. We will come to each one of this in the following slides. And they infect various parts of the human body. It can range from mild skin infections to, say, vulvovaginal candidiasis in the females, to infection of the mouth in usually the immunocompromised, and or it can be very, very severe, leading to sepsis in the body, that is circulating in the blood and causing sepsis. They can enter the lungs, causing pneumonia. They can enter the brain, causing meningitis, and they can cause a variety of abscesses inside the body. So there is much morbidity and mortality associated with the fungi, and with limited treatment options available, early diagnosis still remains the cornerstone of management. and hence the role of mycologists to rapidly identify and accurately identify the species, because the species is also related to the antifungal susceptibility, and unnecessary antifungal drugs can also be prevented, because these antifungal drugs are highly toxic to the human body, because fungi are eukaryotes and the human cell is also an eukaryotic cell. So anything that is directed against the eukaryote fungi will also affect the eukaryotic cell of the human beings to some extent. So cytotoxicity of these antifungal drugs is very, very high. So we need to judiciously use this in humans. And there is increasing antifungal resistance, and the causes are mainly agricultural and industrial. I want to stress here that although there is a trend of some irrational prescribing of antifungal drugs, this is not a big issue compared to 70 to 80% fungicide use in agriculture and in industrial products to increase their shelf life, to increase the crop yield. That is contributing to the emergence of antifungal resistance. So this is going to require intersectoral collaboration and cooperation to stop emergence of further antifungal resistance. Of course, there is a danger of emerging pathogens. Well, I think after so much of fungi, this slide should be a bit cool to you, but the relevance of this is, I don't know, any guesses? So these are the heroes and the heroines you can see who have emerged after 1990 till date. So what are the fungal heroes? Let us see what are the fungal heroes. Rather, they have turned enemies to us over the years, especially in the last 3 decades. So these are some of the fungal highlights in the newspapers and in the scientific journals in the last 2 decades. You can see that drug resistance in Candida species has increased only lately. This was estimated to be 34,800 in hospitalized patients, and 1,700 deaths have occurred because of drug-resistant Candida as of 2017. And you can see also the trend of, the increasing drug resistance over the years. So we need to be really careful to prevent this antifungal resistance in Candida, because Candida is quite ubiquitous. It is present as a commensal but can turn opportunistic and can become a very deadly pathogen in human beings. Other highlights that stress on the significance of fungi or antifungal resistance in Candida species within the intra-abdominal cavity. That something keeps happening inside the body. It is a dynamic structure, isn't it? A dynamic living structure. The human body is dynamic and the cells keep on undergoing some changes. So there is a development of newer Candida species and drug-resistant strains within the intra-abdominal cavity because of interaction with the human cell. There has been increase in the antifungal resistance in Aspergillus, especially the azole resistance in Aspergillus fumigatus, and the amphotericin B resistance in Aspergillus flavus is already known. Aspergillus is a very ubiquitous mold present in the environment. Excuse me. So we need to be very careful, to further prevent emergence of these azole resistances and other antifungal resistances. There has been a warning for the health experts, with the health experts warning the hunters about the fungal infection due to blastomycosis. This has been in medical news in the last decade. Of course, Candida auris is the newest hero come enemy of today. You can see that in 2023, 35 cases in 8 countries were reported, whereas in 2021, it has almost doubled and has risen to almost double the amount of countries in just a year. So it is rapidly spreading, and with no armamentarium of antifungal drugs available against this pathogen, the condition is becoming ominous and the medical fraternity is facing a very big dilemma. So this again highlights the importance of Candida auris. This is a CDC source. It's not that, usually we have a mentality of, okay, if the water is not coming in my tap, is it the same in the neighbors? And if the neighbor's tap is also showing the same sign of no water, you feel pacified, you feel happier. This is, so to say, just a simile, it is not just happening with the human beings, it is also happening in the agricultural industry and with the crops, with various crop pathogens, phytopathogens also causing destruction of the crops and the animal field. So you can see again here that over the years from 1995 to 2010, there has been a rapid increase in the number of plant infecting fungi, and comparatively a slower increase. Of course, there is an increase of the animal infecting fungi. So what does this tell us? What does this tell us? Again, it reminds us of the trophic cycles in the ecosystem. The plants being more trophic, they are infected first because of the anthropogenic activities that are happening. This leads to lesser nutrition and less nutritious crops that the animals feed on. And of course, now it has spread to the human beings as well. And this was evidenced, the threshold came with the COVID-19 when the black fungus, the yellow fungus, and whatnot, all colored fungus were reported. Of course, it is a misnomer. There is only one word for this, that is mucormycosis or aspergillosis of the very highly immunocompromised patients. So these infections are rising these days. What happened in COVID was, you can see that the body was turning acidic. The human body was turning acidic because of various drugs that man has been taking for various conditions, along with a high sugar level due to irregular lifestyles and life habits. This was the culprit actually. That led to all these immunological events like damaged neutrophils, immunosuppression, reduced T cell production. At the immunological level, this was all happening. And there was an over-secretion of various cytokines, this leading to a cytokine storm. And whenever there is a cytokine storm, there is a very high inflammation, hyperinflammation of the immune cells. And that was leading to all the symptoms like high fever, breathlessness, and requirement of ventilators and oxygen masks and corticosteroid therapy, again adding only to the vicious cycle. And this also claimed many lives. Recently, WHO has released first ever list of health-threatening fungi, and this was in October 2022 that WHO came up with, the priority fungal pathogen list, dividing it into the critical group, the high group, and the medium group. You can see here the organisms that are classified in this way. In the critical group lies the Cryptococcus neoformans, Candida auris, Aspergillus fumigatus, and Candida albicans. So we will concentrate on all these three in the coming slides. There have been other outbreaks reported recently this year. In April 2023, there was an outbreak of blastomycosis happening at a paper mill in Escanaba, Michigan, affecting almost 100 workers. And very, very recently, again in April 2023, the first human case due to a phytopathogen. Phytopathogens, you all know better. I think the audience who are here know this better than me. Phytopathogens usually do not cause disease in human beings, but this is the first instance that Chondrosterum purpureum, also known as silver leaf disease of plants, usually in the rose gardens, these are not known to cause human infections, but this has occurred, but thankfully the patient survived with antifungal treatment. So what I want to highlight here is hitherto unknown fungi from the environment known to cause disease only in plants are crossing the barriers very, very easily and coming to infect human beings. And this is a very ominous scenario. We need to address it at the roots and not just beat about the bush. There has also been increased incidences of valley fever in the southwest of USA, and it was said to have devastating consequences. There has been an outbreak of suspected fungal meningitis associated with surgical procedures performed under spinal anesthesia in United States and Mexico. So all these things highlight that with increasing rapid developments, technological advancements, the scientific advancements, it comes along with a very heavy price of the fungal infections as well. So you need to know the host-related factors. That is, we need to concentrate on increasing the immunity. We need to limit the use of antibiotics. We need to curtail the use of unnecessary steroid drugs. And coming to agent-related factors, there has been increase in the species of fungi, mainly because of their dispersal of spores due to degradation of land and construction activity. So we need to decrease that also. And they have gained ability to survive at higher temperature because of the global warming and the climate change. Of course, this is a very complex situation which needs multiple collaborations, but we have to do it anyway. There is no other way out. There are various challenges in the management of fungal infections, and these are the lack of well-equipped diagnostic labs, especially in India, the lack of antifungal drugs, which are very, very costly. They are very, very toxic as well, toxic to the kidneys and to the liver. And so we will definitely not like to go to the situation of treating fungal infections. Rather, we need to prevent it. Nearly 90% of invasive fungal infection-related deaths are due to these two fungi, that is Candida and the Aspergillus. So you need to do anything and everything about it. We can also, it is a rising public health threat, mainly because of increasing opportunistic infections, with the human population becoming more and more weakened with the immune systems, like the HIV/AIDS is rising, the cancer patients, the transplant recipients, and people taking medications that weaken the immune system. This population has increased over the years. So although there is said to be increased life expectancy, there is much of morbidity, and this is adding to the burden of opportunistic infections due to cryptococcosis and aspergillosis. Hospital-associated infections are a nightmare to the medical fraternity, and there is no looking back, because we have advanced so much that now we cannot go back to the age-old, the primitive ones. So there is a big challenge looming on us. Community-acquired infections like coccidiomycosis, blastomycosis, histoplasmosis. Usually, earlier they were not seen, especially in India, but nowadays histoplasmosis and blastomycosis, these are being reported from India also. Coccidioidomycosis, classically a valley fever seen in deserts, is now spreading because of the climate change to other geographic conditions as well. So now you may ask when and how to suspect a fungal infection. So these are the conditions when you should suspect fungal infection, especially when a patient has been hospitalized for long and he has been on a standard course of broad spectrum antibiotics, but the fever is not subsiding. Or the patient is suffering from HIV, or he has undergone chemotherapy or radiation treatment or a transplant, or it's basically a community-acquired pneumonia that is not getting better with antibiotics. In such situations, we need to think of a fungal infection, because clinical suspicion is the first and the foremost to finally get rid of the fungus. So these are the immunocompromised conditions wherein you can see the fungal infections are very heavily seen. These are the AIDS and the HIV patients and the tuberculosis patients, wherein these fungal infections are most commonly seen. But there is also a population of immunocompetent or people with no underlying diseases, like the fungal keratitis, tinea capitis, mycetoma, chromoblastomycosis, and sporotrichosis. These are seen in otherwise healthy patients. So it is not that fungal infection will not affect a otherwise healthy patient. So you need to keep this in mind. However, if you have a patient of asthma, AIDS, cancer, organ transplantation, or corticosteroid therapies, there should be a heavy suspicion of a fungal infection. If the patient suffers from fever, unexplained weight loss, not feeling well, there is a cough, there is a coughing up of blood in the sputum, then you should suspect a fungal infection. So classically, the fungal infections, human fungal infections, are divided into these four groups: superficial, subcutaneous, systemic, that is invasive, and the allergic mycosis. You can see the global burden of the diseases. You can see here that skin, hair, and nail infection, that is superficial infections, constitute almost 1 billion of the population suffers from this, and almost 3/4 of a billion suffer from vulvovaginal candidiasis, which is recurrent. You have fungal rhinosinusitis, severe asthma with fungal sensitization, allergic bronchopulmonary aspergillosis, chronic pulmonary aspergillosis, fungal keratitis, coccidioidomycosis, histoplasmosis, and the other subcutaneous infections, which are comparatively lesser when compared to the ones we have just talked about. So coming to superficial mycosis, these are the diseases that come under superficial. That is, the superficial layers of the skin are involved. These are very ugly pictures. Sorry to share it on the social media like this, but these are the conditions that we day in and day out we see in our skin and OPD labs. Tinea corporis, which is commonly called as daant kaj khujli, jise kehte hain. BTEX is used for this. You see it in the TV ads. These are the conditions caused by dermatophytes. That is, the trichophyton species of the dermatophytes usually are responsible for such conditions. So whenever you see such condition, please seek for medical help. Malassezia-associated cutaneous infections can present like this on the trunk, like this, pale colored, discolored patches on the skin, or a flaky scalp, or it can appear like an atopic dermatitis. So you should keep it in mind whenever you see a condition like this. Black and white piedra are not really very common in the place I live actually, but we really don't know the clear incidence of this. Subungual onychomycosis. Onycho means the nail. So the mycosis means fungal infection. So the fungal infection which affects the nail is called as onychomycosis. This is how discolored, yellow, flaky, brittle nails they become, because the fungi go deeper into the nail bed and they cause this disfigurement. Keratomycosis is a condition wherein an ulcer-like condition occurs in the cornea of the eye, usually because of trauma. The trauma can come in the form of a foreign body, like say an agricultural worker is working on the field, a splinter of the plant has gone into the eye along with the fungal spore. Then this condition occurs. These are all the pictures of fungi that we have recovered at our lab in the JLN Medical College Microbiology Lab of Ajmer. This is Fusarium, this is Aspergillus niger, this is Candida. So you can see this is the Alternaria. So these are some of the causative agents of corneal ulcers known as keratitis. Otomycosis also occurs especially because of poor hygienic conditions in low socioeconomic condition people, wherein Aspergillus spores or Candida grows inside the external auditory canal. When you grow it on media, they come up like this. These are the fungi growing on the culture medias in the lab. So this is the prevalence of superficial and subcutaneous mycosis. So you can see that, at least concerned about India, you can see India has chromoblastomycosis, which is a subcutaneous infection, Tinea imbricata, that is the dermatophyte infection, and eumycetoma, again another subcutaneous infection. So these are the various subcutaneous infections. Those highlighted in red, we are seeing increasingly in Ajmer, where I live. Subcutaneous mycosis again presents like this, very ugly pictures, the pustules, ulcers, and small abscesses, or it can come like a non-healing wound, like when it is a eumycetoma, and entomophthera mycosis, wherein there is much disfigurement. So these are all caused by fungi. So whenever such unusual things come to your knowledge, you should suspect fungal infection and you should take the patient. Non-healing wound infection, these two cases. This is the first case of Trichosporon luberi reported from our lab in JLN Ajmer, all over India. It is the first case, and in the world, this is the fourth case reported due to Trichosporon luberi. The patient responded very well only after we diagnosed the condition and antifungal was given, and the patient was okay within 20 days. Otherwise, the patient was admitted for more than 2 months. Just because the clinician did not suspect, they did not send the sample to us, they did not call us. So he was treated simply with antibiotics and it was not responding. But once the diagnosis was made, antifungal was given, the wound healed, and you see, this is the condition. In another 20 days, there was a very good healing. This is after 1 month of continuous antifungal treatment. So this is how we can help with early diagnosis and appropriate treatment. Subcutaneous mycosis can also occur in the form of chromoblastomycosis, pheohyphomycosis, rhinosporidiosis. These are the clinical pictures that come to you when you should suspect. Systemic mycosis, these are the regular systemic mycosis, wherein these are called by the endemic fungi or the dimorphic fungi, Histoplasma capsulatum, Coccidioides immitis, Blastomyces dermatitidis, Paracoccidioides brasiliensis. These can infect normal, healthy adults also. It's not that the immune system need to be weak for these to cause infections. That is why they are called a systemic mycosis. Sporothrix-Schenckii and Talaromyces marneffi infection. These are also dimorphic fungi, and infections due to these are increasing these days. See, if this is the patient of histoplasmosis, how much of disfigurement on the face you can see. This is a case of blastomycosis. See the ulcerative lesions in the mucocutaneous areas around the mouth and the nose. This is how it presents clinically. There are various opportunistic systemic fungal infections like candidiasis, cryptococcosis, aspergillosis, and mucormycosis. There is a increasing list due to talaromycosis, pneumocystis carinii pneumonia, pityiosis, cerosporiosis, fusariosis, and trichosporinosis. All these diseases are coming up in increasing number these days, but candidiasis still remains the commonest systemic opportunistic fungal infection. It can affect any part of the body, as you can see here, affecting the nails, the skin, the vagina, the male reproductive systems, the organs like eye, brain, and the bones. In the mouth, it appears as thrush. So it can infect any part of the body. These are the clinical pictures of candidal oral thrush and mucocutaneous candidiasis and of the feet. Another thing about the candida is that the candida auris, as we had already talked about, is multi-drug resistant, and it is said that the US candida auris outbreaks are linked to the healthcare systems in these countries. The medical tourism has promoted spread of these infections. Cryptococcosis is another looming infection, especially in the HIV/AIDS patient and other immunocompromised patients. The patient presents with cough, pleuritic chest pain, and symptoms of pneumonia. A chest radiograph is usually indicative of the condition. Aspergillosis is increasing with various clinical manifestations: chronic necrotizing, allergic, or ocular, or acute invasive. So whenever aspergillosis becomes, blood invasion occurs, it can lead to death just within 24 to 48 hours. Allergic fungal rhinosinusitis is increasing these days, especially because of so many allergens and the allergic aspergillus spores in the air because of increasing construction activities. Zygomycosis, also known as the mucormycosis, which we learned during the COVID time. I think I need not stress it again. We all know much about it by now. Talaromycosis is more common in the Southeast Asian countries. As you can see here in the map, it is prevalent much in these Indonesia, Cambodia, and these areas, wherein Penicillium marneffi, now known as Talaromyces marneffi, is increasingly prevalent, and HIV/AIDS is also very rampant in these areas, and it causes clinical presentations like this. So now, after seeing so many fungal infections, coming up, cropping up, and emerging, we understand now the laboratory diagnosis of human fungal infections is very, very important because they mimic other infections. Just by seeing clinically, the physician will not be able to differentiate whether it is viral, bacterial, or fungal. Say a patient in sepsis, admitted to a hospital, sepsis, there is fever, and there is hypotension, and there are features of sepsis. The physician will not be able to say whether it is bacterial, fungal, or viral. He has to take help of laboratory diagnosis and laboratory tests to differentiate which it is, so that the appropriate choice of antifungal drugs can be given. And antifungal drugs also show species specificity. For example, Candida albicans may respond to fluconazole, but Candida krusei is traditionally known to be inherently resistant to fluconazole. So there is no fun in giving fluconazole if it is Candida krusei. So species identification is very, very important because of this. And also because these antifungals, the three major group of antifungals you are seeing here is the echinocandins, the azoles, and the amphotericin. These are highly toxic. Apart from being very, very costly, amounting to more than $1 lakh for one treatment course, these are very, very toxic. The echinocandins can cause vascular diseases, the azoles can cause liver damage, and amphotericin can cause kidney damage even during the routine course of treatment. So we need to be very cautious in the use of these drugs. Timely treatment, of course, can prevent disability and death, but inappropriate and unnecessary treatment can lead to toxicity and its complication. So it is a double-edged sword, which we need to use very prudently. And outbreak potential with emergence of cryptic, drug-resistant, and highly pathogenic strains also warrants importance of laboratory diagnosis. And of late, especially after the COVID, we are increasingly coming to know of immune reconstitution inflammatory syndrome, which the fungi can also cause, especially the Cryptococcus. So these are the methods we have in the laboratory to diagnose.
Excuse me, ma'am. I mean,
yes.
we are running out of time.
Yeah, I'm winding up in 2-3 slides. That's all. Yeah.
Thank you so much.
Yeah. Thank you for reminding. So microscopy, culture, antigen detection, serology, histopathology, the imaging system, and molecular identification are the cornerstones of treatment. Increasing molecular tests with microarray and MALDI-TOF are really very useful because they are very, very rapid. Biomarker identification is especially needed in case of invasive fungal infections. And there are certain underappreciated fungal challenges which we need to address. These are the improper diagnosis, poor infection control, especially in hospitals, medical device contamination, and fungicide adaptation and extensive use in agriculture. These all leading to antifungal resistance and complicating the situation. So the solution lies in increased awareness, real-time monitoring, disinfection, sterilization, eco-innovation, risk mitigation and modeling, and sustainable solutions, especially the yes. So to just summarize and conclude, we can what we have understood over this presentation is fungal infections are rapidly increasing due mainly to unmindful anthropogenic activities leading to rapid change in ecology, weather and environment. With displacement of fungi from their natural niches and homes, selection pressure and adaptation occurs and widespread emergence of newer and drug-resistant infections like all these happens. Rapid development of antifungal resistance is troublesome and is mainly due to rampant use of fungicides in agricultural and industry. Hence, prevention requires intersectoral cooperation of these collaborators as well. Laboratory diagnosis is a must, as we have already seen. So, the final point to say is fungi, often viewed as pathogens, possess crucial eco-friendly traits. So, actually, they are our friends, but we need to keep them in their home and not displace them. Recognizing fungi's ecological importance is vital for coexistence and ecological balance. Embracing a bio-based economy aligns with sustainability goals, utilizing fungi for efficient resource use. Advocating for sustainable and awareness practices enables us to reduce the fungal burden and the infections, not only fungal, other infections as well, and to restore the climate change. So I always use this slide to make the young generation aware that we need to sync with nature. I keep telling achar, vichar, ahar, vihar. We need to sync with the solar cycle, the dawn and the dusk. What importance does this have? The circadian rhythm all lies aligned with this. If we align with this, there will be very, very less diseases. If we disalign, if we sleep at 2 a.m. when actually we are supposed to be waking up later, then it's definitely going to cause dysbiosis of the body and dysbiosis of thoughts and emotions that is going to lead to diseases. In fact, I recommend the youngsters to visit Dr. Elaine's Soil Food Web School to understand more about the nature's principles, how the soil is important for us, how the fungi in the soil are important for us, the soil food web. Otherwise, lest if we don't understand and master these techniques and go back to the age of the agricultural age, India kabhi sone ki chidiya hua karti thi. If we don't go back to that, The Last of Us Remastered, this is a TV show that has come up recently, wherein an unknown fungal outbreak leads to extinction of the human species. This doesn't seem to be really very remote if we continue doing unmindful activities. So with this, I want to say a thank you to all your patient listening. Thank you, Lord.
Madam, thank you very much for that inspiring talk on clinical fungi and their and the public awareness about clinical fungi. We could take a couple of questions. Dr. Arvind, please ask your question.
Thanks for the opportunity, sir.
Yes.
Ma'am, as you were saying about the immunocompromised patients or the hub for the fungal infection, so as then treating the patients with the antifungal drug, the development towards the immune drug which can aid the patient in improving the immune system is required than the drug which can kill the fungus. As of my thoughts, I need your opinion how it can be there, because in similar cases when you said about the fungal treatment need to be done for the couple of weeks, that is more than a month, and it has a severe effects on the vital organs too. So, so then why there's a need for the antifungal drug then treating the patients with the immune drug which can be induce the immune cells and be help them in that way? Your thought on that?
If I've understood your question correct, may I know your name, please?
Arvind, ma'am. Arvind, yeah.
Yeah, Arvind. Yeah, Mr. Arvind, I think I've understood your question right. The question you asked is, why do we need to use such, highly toxic antifungal drugs, the costlier ones, for a longer time, when actually we can be, modulating the immune system with immunological drugs? Is this the question?
Yes, ma'am. Yeah.
Actually, it's not that simple. Prevention is always better than cure, but we seldom apply our time and effort on this line. We always allow the things to become worse, and when it is in a difficult to cure stage, only you start the treatment. So this is what is happening. If the patient comes early, definitely we won't need many antifungal drugs. But if it is a life-threatening condition like say sepsis or a CNS infection or a pulmonary infection or a deep-seated infection, it is usually not possible to reverse the condition with just the immunological drugs. You need to use an array of armamentarium of all these tools you need to use. Antifungal drugs along with certain immunomodulatory agents and certain lifestyle practice change also if the patient is not in the hospital. All these will have to go together. And the most important part is also the diet. In a hospitalized patient, diet becomes very difficult to control. And but I would rather say even for a patient in the community not hospitalized, we are not concentrating on our diet. That's why the last slide I told you to go to this Dr. Eileen's soil food web and understand the importance of nutritious food and to grow nutritious food. That will only build up the immunity. Just the immunological modulation will not take care of a very severe fungal infection which has gone deep rooted in the body. So it's very tricky to say, it's very tricky to actually address once it comes to invasive fungal infections. Superficial fungal infections, yes, I agree. I have treated 2 to 3 cases of dermatophytosis just with a lemongrass oil. Just with lemongrass oil, no antifungal at all. So it is possible to do that if it is a milder superficial infection, but for deep infections, there are a lot of things to do and apply.
Okay, fine. Again, the second question is, I believe the hype towards Candida auris in India, it's too much than compared to the other Western countries. Because when I see the global reports comparing the papers which is published all over the world, in CCD report says of the United States, all the countries has a high growth of the Candida auris, but in India it's very less. So it's necessary to take a prevalence which is very less, but giving a overhype for the Candida auris because of its multi-drug resistance, and it's not showing any high virulence factor like Candida albicans.
Yes, I think it's a good question, Mr. Arvind. But again, a tricky one because these are the days of the global eras. It's not that India is secluded from the outside. There is so much of travel and communication. So much is happening. There is medical tourism happening. So you will never know when very highly resistant Candida auris erupts in India also. Also in India, the research is not that strong. The prevalence data and the statistics is not that strong. And sometimes I feel this is a bliss, this is a boon in disguise. Because once you enter into statistics and monitoring and epidemiology all the time, I think you are actually inviting things. This occurs at a subtle level.
Yes.
And the Western world doesn't, understand the subtle things that India used to have it in its culture, if we go back to the roots. So to answer your question, I will say that yes, Candida auris, not that much of outbreaks have happened in India, thankfully, because of various measures that are already in control, and that we are not so vigorously treating with higher technology, latest equipments and all those things, with the patients becoming more immunocompromised. These scenarios are more common in the Western countries. So let us not just ape, the Western world for the so-called advancements that they are coming up with. We should remain rooted to our culture, understand things, and prevent such things from emerging.
Fine.
I think that is a very good question, a thought-provoking question. We can have a big debate on that.
Yes, ma'am. I used to have it my guide that goes up, ma'am.
Yes.
Thanks, ma'am.
Yeah. Welcome.
Thanks, ma'am.
Thank you so much, Professor Vijaylatha Rastogi.
Yeah.
I'm sorry, I'm not able to take up many more questions.
No, it's fine. It's fine. You need to stick to the time. Sorry if I've taken more time.
No, it's okay. It's okay. But it was a very insightful talk and as usual, full of energy.
Thank you so much.
Thank you so much. I am sorry again. I can let you go now. Thank you so much. I now request my friend Professor Krishnakant Sharma, and I welcome him to today's program. Professor Sharma ji. Professor Krishnakant Sharma, can you hear me? Professor Sharma, are you there?
Yeah, can you listen me? Hello, am I audible?
थोड़ा voice का issue है.
Hello, am I audible?
Yes. Yes.
There was some problem with, I'm sorry for that, audio system.
Madam Vijaylatha, please stop presenting, please.
Just a second, sir.